the topic which was given to me was because the whole webinar is on sports nutrition, but from a sports medicine perspective, to introduce sports medicine and its scope and its relationship to nutrition, and how as sports physicians we do our part of the work, and how the nutrition is can come, and how do they can uh, help athletes to perform, to be healthy and to perform better. So my talk would be mainly focusing on the sports medicine aspect of it. And during that time, I would draw relationships of where the nutrition comes in and how we can move forward. So, so as for a start, when you talk about first, I have no conflict of interest to declare. And as a start, I'd like to introduce who's an athlete. So the word athlete has been discussed maybe about 450 BC. This is the first, I think, older sculptures that we see about any sport being involved. So this is found in Greece, 450 BC, and talks about mainly about strength, endurance, state of control, I mean, the symmetry, the body, if you see there, it shows the anatomy perfectly of a human being, uh, and how he controls his mind, body, and spirit. So this is one of the oldest way of describing an athlete. So by that time, sport has been mainly arose in Greece, and 770 BC, where you had the old Olympic Games, which were mainly types of activities that use for warfare. So mainly people showed their strength and abilities and skill through warfare, because wars are the ones which were one of the main focuses in the world at that time. But with that, the Olympics came, and the people were looking into these skills of athletes. And throughout that time also, there were physicians who were trying to get these athletes better, mainly on performance, and to get an edge over one another. So that has been there for a while, but after a period of time, it kind of faded away. But then the modern Olympics came. This person called Pierre de Coubertin in 19th century brought again the modern Olympics. So why I'm talking about Olympics is because that is the biggest sporting event in the world, where all the countries participate, and almost best of all the sportsmen compete. So that's the biggest extravaganza, if you really think, where all the countries come into one place. But now the sport has become different. It is an entertainment. It's a global event. More recognition, a lot of money come in, and these athletes are celebrities, and even politics are made around that. So the game has changed. It's not only physicality or what we spoke about athletics, but around that there is an industry being built. So with that industry, definitely the medical, nutrition, and other aspect of science have come in to improve these athletes and keep them healthy to compete. So likewise, the discipline of sport and exercise medicine has evolved over the last 30, 40 years to a very high level. It has become a branch of medicine and science to cater for these people who do sports, but not only sports, but anybody who does any physical activity, exercise. It has been one of the ways of taking care of their health, and also to perform them better. But apart from that, this has again expanded more with the rise of non-communicable diseases, the obesity, and all the non-communicable diseases. Worse, the WHO has identified lack of physical inactivity as one of the main causes of one of the fourth leading cause of global mortality. So because of that, exercise prescription by all doctors has now become one of the key areas that even a normal doctor should know. So because of this, this field has changed from sports medicine to sports and exercise medicine now. So that's the history of the area, and where I come in is mainly talking about athletes and high level athletes and how we cater to them as physicians, and how the nutrition is so much important in this part of discipline. When you talk about sport and exercise medicine, I can show you different branches of sport and exercise medicine. From the top, you can see one is injury management, injury prevention, and rehabilitation. That is one big area. Athletes, they compete throughout the year. They train throughout the year, 2, 3, 4 hours per day, maybe 4, 5 days per week. And so they are very much having a lot of musculoskeletal injuries, and they, to prevent them from happening, and if they get it, to quickly treat them, rehabilitate them, and get them back to training is one area. The second one of the most areas is, even though if they do not get injured, to improve their performance by way of strengthening, conditioning, nutrition, psychology, managing at a game. So there are aspects of performance enhancements. These athletes are humans and they have medical problems. So to treat any medical problems also in these athletes, there are athletes who are even pregnant. There are athletes with asthma. There are athletes with diabetes. So that part of management is also comes under this scope. Doping is where people use substances and methods to improve their performance. And that is because of the perks that they can get and the recognition that can get. Athletes can go into various types of modality to improve performance. So doping is where you use medicine or any other procedure to improve performance. So that is one area that we work on. And as nutritionists, you also know, there are banned substances. There's something called World Anti-Doping Agency, Sri Lanka also, and most of the South Asian countries have their local agencies to prevent this part. So that is also comes under this. We travel with athletes as a team. We manage teams sometimes. You take care of a team. So sometimes you have to travel with the team. So Sri Lanka cricket or maybe Asian Games. So we travel with the athletes. So last Asian Games in China, I traveled with them, about 150 athletes, different disciplines. For about 1 month, we stay with them. So that is one part of that. So all their issues have to be looked after. There are special groups of people who do sport, like children, pregnant ladies, disabled people. Now there's one, you have Olympics, you have Paralympics, and now there's another thing called Special Olympics. These are for people with special needs. So these, all the populations are involved in sport, because sport is one way of, I mean, having a good quality of life, socially, and having a healthy life. Sport is taken as one of the area. So all these populations get involved in sport. Exercise testing, it's just like you test your blood sugar level. We can test the exercise capacities and change them. So that is one area. And exercise prescription, as I told you, just like medicine, just like nutrition, you prescribe exercise also, which has come very high because of the non-communicable diseases. All doctors, and there are exercise physiologists, there are physiotherapists who prescribe exercise to normal people also. So that is, the scope is very large and it's evolving. And to support this whole thing, we have other support groups. It's a multidisciplinary team. When you are talking about managing an international athlete or a national athlete, or even now, even a school athlete, we need a team. So the doctor is there, plus sports physiotherapists have their specific disciplines on sports physiotherapy. They come in this team, and sports science is not sports medicine, sports science. They mainly work on analytics. You test, you analyze teams, you test their physicalities, and support coaches to improve. And sports psychology, the psychology changes all the time in athletes, not at even at the level of sport, but during training, during other day-to-day life, their psychology should be looked after. And massage therapists, and also strength and conditioning coaches. There are separate people who look into their strength, their conditioning. So there are multiple types of people, and sports nutrition is one of the major key players, where when we deal in a multidisciplinary team, we always talk with some of the areas we looked after, some of the advanced areas that there's a separate sport nutritionist who look after that. So when you look at this slide, you can see the scope, and where nutrition also comes in different places, in injury management, in strength and conditioning, in doping, in team care. All these places nutrition comes in. So in my slides, I would really try to get into several themes where we have the nutrition mainly involved, and I will slightly discuss and introduce you where we are working collaboratively. So this is a multidisciplinary team looking after an athlete or a team. So when we talk about sport, I told you everybody wants to win a medal, right? So it's very competitive. And we always talk about how you win a medal, whether you win a medal at your school level, or then at your provincial level, state level, then national level, then international level, competing at international level, and even winning a medal at international level. So that is the levels we are talking about. For an athlete to win a medal, you need three components. Number one is the skill. So skill in the pyramid, that is the most important one. If you are not skilled, like if you think of cricket, you can't be Virat Kohli. Everybody can't be Virat Kohli. So because you need that skill. And the second thing is, when you have the skill, all the players who are in these three international teams are very skilled. They are the most skilled people in that country. But for you to maintain this skill and play throughout an year or a season or throughout years, you need your physical fitness. So physical fitness is the second most important thing for an athlete to maintain that. So you have both of that, but to compete and become the best, you have to have your psychological and mental fitness. So these are the three areas that we try to optimize in athletes. You can see, so some areas you have to come with your parents, like it's coming with your genes, skill. Rest of it is actually you can train. So what you say is, if you want to become a Olympian, you select your parents. So likewise. So when as physicians, we look into different fitness parameters. I was talking about the fitness because you have to be fit to stay in the game. There are two types of fitness parameters. One is health related. The other one is skill related. Health related means all of us as humans should need these fitness. If you have these fitnesses, you are healthy, and at the same time you don't get into these non-communicable diseases. One of the first things is cardiopulmonary fitness. That is ability of your heart, lung, and muscle to do it activity. How much you can run, how much you can walk and sustain like that. That is your how many stairs you can take without getting breathless. That is your cardiovascular fitness. So a 100-meter runner is fit, but a marathoner is also fit, but marathoner has more cardiovascular endurance, who can sustain fitness. The other one is muscle strength, muscle endurance, body composition. You are aware of this. So your body composition is taken as a fitness parameter. So these things you have to have in everybody. So in athletes, anyway, they are good in this, but sometimes their flexibility, their muscle strength, endurance, their compositions, they change. I'll take an example and tell you. So we are trying to optimize these parameters, and some of them are skilled. It depends on the sport you do. Agility means how quickly you can cut across and move. A footballer has agility. He can quickly cut across and move. Balance is another fitness parameter. Like a gymnast need balance, coordination. A batsman might need hand-eye coordination to uh, do his stroke play. Power, speed, these are all considered as skill related parameters. So in our area, we try to optimize these things, but the others support like strength and conditioning coaches, all these support, but we try to keep them at the highest level when they perform. So you take different sports. Like this is, I hope you know this person is one of the greatest short distance runners, Usain Bolt. Now he has anaerobic fitness, speed, strength, power. So different sports have different fitness parameters. This is a marathoner and he has a lot of endurance and speed. He's not bulky and muscular like others. A footballer, this is Ronaldo. So he is not that tall, but his speed, his power, his muscular. So different endurance. So different capacities are there. So he runs almost about 4-5 kilometers during a match. This is rugby. So he needs a lot of power and strength compared to maybe endurance. Badminton, it's a skill related sport. You need a lot of skills to maneuver your racket and endurance. So likewise, there are different sports which needs different physical fitness parameters. Why I'm coming towards this is to improve each of these parameters, you do different types of exercises. To improve endurance, you do aerobic exercises. So when you do aerobic exercises, your nutritional requirements are different. And when you do power exercises, like explosive exercises like rugby, you lift a person and you go and hit on another person, you need a lot of muscle bulk, lean mass, plus strength, plus speed. So their nutrition requirements are different. When it comes to a gymnast, like most of them are less than 50 kilos. So you have to maintain their weight and their nutrition requirements are different. At the same time, they do a lot of explosive activities. So we need to know these different fitness parameters to optimize their nutrition requirements also. So sport performance, to achieve high performance, as I told you, we need interrelation of most of these physiological plus psychological factors, but psychological factors come very high during international level, but uh, but uh, but that is a very fine-tuned level. But most of it can be taken at physiological. So we kind of try to, this red line shows, the y-axis shows the performance and the timeline. So we want to get this athlete from A to B in this process, and where he wants to achieve maybe the red line. So in this getting from A to B, you need a lot of training interventions, medical support, psychological support, nutrition interventions to get there. So that's what we do. We profile an athlete, we look into all his fitness, psychological, nutritional, and all these parameters and try to get them to this performance level, considering all these required fitness levels. But the coach is the main person who does it, but we come as support staff. So this is an athlete profile. So you profile an athlete on different regions, medically, nutritionally, fitness wise, maybe even immunization wise. So you have records and you try to optimize. Okay. So that's the background of what we do. And now I will show, how it is done. So, if you think, normally, when you look at an athlete, he's training all the time. He's training. So this training can be divided into a couple of areas. They train to improve performance. So take a swimmer, he keeps on swimming, and his coach must be correcting his his maybe the stroke, his technique, how he do things, how he breathe. So that's called skill related performance training. That is what people do to become better, the best. Now, I told you for that you need the skill to become better, right? Some people try, but you stop somewhere because your skill level is less, right? But there are skilled people who don't train much. So then also you don't get better. So you need to be skilled and you should be able to train also. So that's what they do. But as I told you, to keep them fit, there's another thing called strength and conditioning. Strength is building different strengths, not only muscular strength, cardiovascular strength, flexibility, all these things build up to a level that they are performing at a high level, maybe to be able to train 3-4 hours per day for 5-6 days per week, and even compete maybe 10 competitions per year. So you need a lot of strength, endurance to do that. So that is strength, and you have to be conditioned to do that. So that's called strength and conditioning. That's one of the major areas while you are working out. So they do a lot of exercises, go to gym, do exercises, and then the third part is recovery. When you are training a lot, you need to recover your body also. So that's called recovery. So all these three areas, you need nutrition, you need psychology, you need injury prevention and management, medical screening. So these are the three areas that we need nutritional input. All these three areas need nutrition input. It's not just giving something to eat and say your energy enough, but we work on these three areas. Like 2 days per week, they must be doing strength and conditioning. All 5 days they must be doing training. So their food should be adjusted according to that. So strength and conditioning look into all these fitness parameters. So they run, they jog, they swim, they go to the gym and lift weight to improve the strength and endurance. They eat a diet that we tell them to eat to keep your body composition well. They'll do a lot of flexibility, stretching exercise to keep your bodies and the joints moving properly. So this is one area where the nutritionist have to support. So if somebody wants to build muscle, we need to support them to build that muscle, right? More protein, how you plan your protein, what type of proteins, and if at the same time if they're having some endurance work, how you titrate that without changing your body composition, your fat levels. So that is where the specialist advice comes in. So when you think about cardiovascular endurance, that is the biggest type of fitness parameter that we know. The endurance, the ability to sustain a movement. We measure that with something called VO2 max. There are tests now where we can measure the fitness. So when we measure the fitness, we have some numbers to work around. So that is one of the areas that we work currently evolving a lot, where you check your fitness and you have a number. Those days is just that's where the science has come in. Those days the coach just asks you to train, and according to the coach's thinking, you think that's the level. But now you have numbers to work on. We know where the international athletes' fitness levels are, and we try to push them to that level. So we have a number, just like blood glucose level, there is a way of measuring fitness. So you can see very high level of athletes do participate in these type of tests. In Sri Lanka also we have it. India also you have two labs. I was also fortunate to start up one lab at Hyderabad, where Mr. Gopichan and the people who play badminton, they were also involved. So these things are coming in very much into science has come in on testing athletes and performing with scientifically. So because why I bring this in is this is important when we plan the nutrition. So just a bit of this VO2 max. VO2 max is if you look at this graph, on this side is the amount of oxygen you take in. This side is exercise timing. When you do an incremental exercise, now the blue color is oxygen, red color is carbon dioxide. So when you exercise, you increase both of that. And at a point, you start building lactic acid, and this lactic acid spills over to the blood, and you get anaerobic metabolism going at the later stage of exercise. So there is a time that you predominantly work with oxygen, and then you predominantly go anaerobic. So these changes happen in people in different times. When you are predominantly using oxygen, you mostly use free fatty acids. But when you start shifting, you go into glycogens. And the energy sources are different. So when we want to improve the fitness, we have this time of shift, we want to move further this way. So you have more time training with oxygen. So it is easy. So when you can train more with oxygen, you can train your skills more. So even during weight reduction, when you work exercise in this predominant oxygen state, you use a lot of free fatty acids. But afterwards, when you're running and when you're brisk walking, you are mostly using free fatty acids. But when you're going for the run, it is mainly glycogen. So likewise, these types of testing, and we can really say at what heart rate level this thing happens, and how we can plan our exercise patterns, whether it's explosive, it's just endurance, according to these heart rates. So you can see some athletes using their watches, heart rate bands to do this. So nutrition wise, also we alter different things. I will take an example how we did that. And so likewise, nutrition is coming in high way that to handle these type of things. So this is the VO2 max. As I told you, the maximum amount of oxygen you can use at maximal exercise is considered VO2 max. So athletes, like, highest level recorded is like cyclists who are endurance cyclists who cycle for 100, 200, 300 kilometers. They are considered the highest. And even swimmers like Phelps, who are like endurance, they are considered very high, 76. And we have had national runners around 65. So depending on their sport level, their capacities are different. Like you and me, average male may be around 35, 40. So this pronghorn is considered as the highest endurance level of 300. So we know these numbers. Because of that, we work around these numbers to optimize the endurance capacities. So, but how to use these numbers? We do is one example I'd like to say. This is with his consent. I'm using this data. He's Sri Lankan national 400-meter runner. He's one of the South Asia's first 3-4-2-3 runners. And I was just telling, he had an issue in his 400 meters. During the last 100 meters, he started cramping and his body was very tight. So we tested him in 2021 with this cardiopulmonary exercise testing, and we identified his lactic acid buildup happens pretty early. That is because he has a lot of white fibers, and he's a very explosive runner, so he build up acid faster. So we tested him, and there were changes done to his training. Um, for his we included a lot of endurance training, and even the speaker who was next depend to speak, Professor Ranil Jayawardena, was also involved. And because of lactic acid, we incorporated uh, uh, nutritional changes to his diet to reduce this lactic acid buildup. So likewise, then actually after 4-5 years, he has become his timing has dropped from about 1 second. That is a huge change. And recently also he ran. Now this difficulty in last 100 meters have come to about last 5 meters. So likewise, there are very specific interventions that can be done with nutrition, changes of his training pattern. and different types of modalities being used to change his quickly developing lactic acid to wash it off quickly. So, so that is one example I'd like to show. So this is important to train your fitness, different aerobic, anaerobic fitness. Like when you're really running fast, you use a lot of anaerobic fitness. And if you want to lose weight, how you use it. So these things are involved. And now body composition is your area. I think how you change fat and muscle is very important, and it is important for us also because these athletes, different types of athletes, there's no set correct athlete body profile. It depends on your type of sport. So some people are bulky, some people are thin, some people have muscle, some people don't have that muscle, some people are short, some people are has huge weight. So what I'll show you is this body composition also changes depending on the type of sport they do. So there is no standard one way of doing it. But in general, we know we know that your body composition, your skin folds, or we do DEXAs to identify their fat levels. And the exercises that we do during preseason, we might change, doing a lot of endurance work, depending on the athlete. Some people even a lot of strength work to improve their muscle mass. But sometimes we might not want to improve a lot also, like say a rower. We don't want to change a lot his weight because if your weight goes really down, then he can't row because you have to balance the boat also. So likewise, it depends from sport to sport. So talking with your physician, nutrition physician, the coach, is very important to cater to whatever the nutrition you put into an athlete because we all should be on one plan. So when we do some changes, if the sports nutrition is doesn't really add on to that, it doesn't work. So I always we call and we talk and we do changes. So that's how we do it. So I mean, always it is considered more muscle is better, except for sport like this. But still, sometimes we uh, plan plan as a team to how to change a person's weight and body composition. Because number one thing is not changing the weight of or muscle. Number one thing is how better he executes his skill. If it goes out, there's no point doing whatever. So we always look at his skill level and whether it's improving or not, we work around that. So that's one key message that I want to set across. So so other thing is a lot of athletes do resistance training. They build muscle. They want to improve strength. So I think proteins. I think in the next lectures these things will come. Pre and post event protein changes. How you optimize them. How you give that to these athletes are very important. At the same time, at what stage you introduce this is also very important. So sometimes we see very young athletes getting into supplements which we don't really encourage. And so these are things that as professionals we have to decide and see how we introduce different supplements to athletes. So resistance training is where you need a lot of these. You need pre-workout sometimes. You need creatinine. You need protein. You need other cocktail of things. But at what age we introduce is important. We always wait until the last time that you do all the other changes with nutrition. Train them on nutrition, on how to eat, how to recover, timing of eating, drinking water, and then only you introduce the last portion on supplements. Apart from that, we do a lot of medical screening because we need to know not only performance but their general health, their heart, lung, muscle, and how they are doing. So athlete health is the number one thing, not the performance, but athletes think it in the other way. They take their performance at the first. But we as doctors have to guide because the whole other industry is uh, not mainly looking at the health. but looking at the performance. But we are the people who have to at least pull them and keep them, especially when kids are involved. Still, we can see even Sri Lanka, I don't know the other countries, we see very competitive school sport. So that we have to see how we intervene. So these are the two main areas I discussed, like training and strength and condition. We need this nutritional. And the other big area is recovery, which we most of the time don't look into. So when they don't recover well, their muscles get stiffer, harder, painful, and the movements become slower, and then they get into injuries. So recovery is one area that I'm also personally very much interested in, because that's 90% of my patients come with injuries are because they don't recover properly. So recovery is important. It's like this. Now this is performance on this axis, and this side x-axis, it's the timing of exercise. So one day from this line to next day, during training, normally your performance drops. But after training, only during sleep and the next day, you gain these skills and you become better than before. You can see performance level gets to the next level. That's called supercompensation. Then again, during training, you drop during the time of training. Then again, during recovery, you go up. So this recovery point is the time that you actually gain what you trained. But if you don't manage this properly, if you are not eating properly, if you are not getting a good sleep, if you are not hydrating properly, what happens is these things, the recovery doesn't happen properly and you don't get the best performance needed. So now the trend is even the athletes are being monitored a lot during sleep, whether they are getting a good sleep, whether they are, especially their carbohydrate intake is good. Not only protein, we focus a lot on protein, but sometimes the carbs are not enough when it comes to energy loss. So recovery is another area that the nutritionist should be aware of, how to recover them, how to give them adequate nutrition, the fluids, electrolytes, and sleep. So all the people should tell the same story, like nutritionist or a doctor or a physician, sports medicine physician or a coach or whatever. They should know that recovery is the time that really they really gain something. So if not, what will happen is there's something called overtraining and overreaching, and they go into overtraining syndrome, that then they go into a injury profile and they start losing their performance, their mental state, they get burned out. All these things happen if we don't recover them properly. It's a continuum. We have to identify athletes. I mean, now you call it REDS, relative energy deficiency. So the identifying that is important, and talking with the athlete, their parents, and the coach, and telling them this and educating them is part of our plans. So these are the recovery methods. So the rest, active recovery, warm up, warm down, proper eating. And I'm not going into detail about the, I think the next speakers will talk about that. Quality sleep is number one. And the newest problem is the screens, and get them out of screens is the other thing. So in my athletes, I only less than 1 hour of screen time is allowed. Even without that, that is the best. So recovery, just go on. So we do a lot of measurements to even measure recovery. Now there are a lot of wristbands, devices which has come to monitor your recovery, and they give numbers. So we use them also to check whether they are actually in recovery stage. So, I mean, these are the areas that I want to actually check on you. So the nutrition planning, we have to work around this performance profile, strength and conditioning profile, and the recovery areas, and the athlete profiling. So thank you very much. I think I delivered a lot during a small time.